I thought in light of recent events I might ought to reintroduce myself. My name is Lance Armstrong. I am a cancer survivor. I've been asked to come up here and talk about my story of survivorship. I'm a father of 5. Wow. And yes, I won the Tour de France 7 times. And for those who have no idea what I'm talking about, I love you. I just want to acknowledge a few people that are here in the room that are real heroes of mine, great friends of mine. Dr. John Sefrin from the American Cancer Society, I think, is here. Her Royal Highness Dina Moret, Larry Shulman, I don't know if he's here or not, Felicia Knoll, all of our partners in the Global Task Force, thank you for being here. Also, I'd be remiss if I didn't thank Mary and Carrie for their tremendous leadership at UICC. I would also be remiss if I didn't thank my team. I look down here and I see this amazing team of people, Doug, Lois, Heidi, Claire, who am I missing? Others. 80, 85 people, 90 people in Austin, Texas, working every day at the Lance Armstrong Foundation with tremendous passion to rid the world of this disease or help others certainly navigate their way through this disease. You know, my story began almost 16 years ago in a month, on October 2nd to be precise. I'll celebrate 16 years of being a cancer survivor. At the time, I was also a professional cyclist. I had had a fairly decent career up until that point. Came back after the Summer Olympic Games in Atlanta. Started to have a whole host of, all of a sudden have a whole host of symptoms. Obviously, the main symptom, for those of you who don't know, I was diagnosed with testicular cancer, so we can all figure out the main symptom. But I just assumed that a guy who sits on a bike for 5 or 6 hours a day, well, that's maybe normal. All of a sudden that led to severe headaches, blurry vision, an episode of coughing up a lot of blood. And when I say a lot, I mean a lot. Those all eventually led me to the doctor. As an athlete, I think as most athletes, we're fairly stubborn. We're taught for a lot of reasons to play through pain, whether it's knee pain or back pain. I had excuses for everything. I had excuses for coughing up blood for 30 minutes straight. I had excuses for blurry vision. I was 25, I thought I was getting old. I had excuses for the headaches. I went out late the night before with my buddies. I had excuses for everything. Finally, I couldn't ignore the main symptom, and ultimately, on October 2nd of 1996, I went down to the urologist and was checked out. That led me to the radiologist, which led for a very long visit. That led me to a chest x-ray. And within about 2 or 3 hours, Dr. Reeves set me down in a small office in Austin, Texas, and was very direct. He said, I have bad news for you. You have advanced testicular cancer, and I've scheduled surgery for 7 a.m. the next morning. Of course, I'm sitting there. This is in 1996. And later on, I'll talk a little bit about navigation and the importance of that concept for us at the foundation, the importance of that concept for survivors all over the world. But in 1996, we take for granted, I see people, hopefully not right now, but I was watching earlier, I saw people on their devices. We take those things for granted. Yeah. We look on the internet, we look on whether it's LIVESTRONG.org or whether it's WebMD or whatever it may be, and we can navigate these symptoms, whether it's a cancer diagnosis or whether it's tendinitis or whether it's a common cold. In 1996, you couldn't do that. I left the doctor's office. I was grabbing every pamphlet and every flyer I could off the wall. That was my navigation. On the way home, I'm calling people asking, you know anybody that's ever been diagnosed with cancer? That was my navigation. You know what we did after that? We went to the bookstore. Remember those things?
Yes. Yes.
Got every book, they're still in existence. We got every book we could about cancer. That's how we were trying to navigate this thing. All the while, in 12 hours I was going to be operated on. I'm thinking, how am I going to get a second opinion? Call Australia? Who's awake right now? So as I'm sitting here as a 25-year-old kid trying to navigate this maze of a new disease in my life, a new foe in my life, I was lost, I was confused. as are many people today. Of course, the world has changed. It's 2012, and we can all get on our devices, most of us. We take that for granted, of course. There's places in the world we've seen all of the information. This discussion was way too smart for me, but I can follow maps, and I can follow numbers, and I can follow graphs. Think of the people in those places who have no access to a device, who have no access to a navigator, to a friend. I met a guy sent me a letter. I tried to read every letter that I could when I was diagnosed. I got a letter from a doctor at Vanderbilt in Nashville. A guy by the name of Dr. Stephen Wolf. He's a cyclist, he's an oncologist. He told me some things to ask in this letter. I immediately picked up the phone and called him. Stephen Wolf became my own personal navigator, which he was more than happy to do. And I might add, unfortunately for Dr. Wolf, he is now in the middle of his own cancer struggle. Thinking about him, wishing him the best. But Dr. Wolf pointed me in the right directions. Living in Austin, Texas, one of the smartest cities probably in the world, yet lacks a major cancer institute, a major cancer hospital. Obviously, you go to Houston, you go to these other places, get other opinions. I ended up in Indianapolis with Dr. Larry Einhorn, who I'm sure this room knows well. His entire team of people, Bruce Roth, Craig Nichols, Scott Shapiro, ended up staying in Indianapolis and being treated. One of the most interesting things when we talk about navigation for me, as Dr. Wolf helped navigate me through the process and get me to IU, an interesting thing happened when I landed in Indianapolis. I had already started chemotherapy. I had already done one full cycle of BEP in Austin, Texas. Most of you guys know that is really standard therapy for advanced testicular cancer. I was due to get 4 cycles. Obviously, there was other things I had to do. The blurry vision and the headaches was because there were 2 metastatic tumors on the brain. Those had to be taken out. Dr. Shapiro took care of that. But the actual therapy was a problem. I got to Indianapolis, and as I'm, again, navigating through this issue, Dr. Einhorn and his team said to me, they said, well, do you ever want to race your bike again? And I said, yes, but I would actually rather just live. All I need to do is make it through another year or 5 years or 10 years, and then we'll worry about whether or not I get on a bike again. He said, well, if you continue on 4 cycles of BEP, which most of us know that contains bleomycin, the damage to your lungs will be so severe you'll never race again. So just that simple decision in that little conference room in Indianapolis in probably mid-October of '96, a switch from BEP to a protocol called VIP, taking out bleomycin, preserving the lung capacity, preserving the lung function. Only downside, I had to stay in the hospital as an inpatient, not a big deal. Without that decision, I never would have gotten back on the bicycle. I never would have raced again. And regardless of what anybody says, I never would have won the Tour de France. The other issue, too,